Hello everyone, thanks for coming. This side event is titled From Piped Dreams to Filter Reality, and we're going to cover a couple of different topics within the broader goal of how to increase access to household water treatment in areas where it's either rural or the market is not there yet. What are different strategies and approaches to increasing safe water access? We're going to have a couple of folks presenting today, and then we'll follow that with questions in between each presentation and a designated time for more audience Q&A and panel discussion at the end. So write down your questions. If we don't get to it, we'll get to it by the end for sure. So first, I'll introduce Jeremy Lambert, the CEO of Business Connect. He will be presenting in a moment. And this is Hank, the managing senior advisor for MetaMeta Smart Center Group. And I believe that Lamesa will be joining us in a bit. He is the country director of IRC Ethiopia. And then online, we will have Lorraine with Water by Women presenting to us. So we're excited to hear from everyone. And without further ado, I will let Jeremy take over. Thank you.
Well, thank you, Jamie, and good morning. First session in the morning and on Thursday, and so are you guys all actually ready to keep going here? 2 more days, right? No, part of our proposition at Business Connect is what's that market approach to safe water, filtration, treatment, pipe. There's lots of conversation around that and move to that, but how do we unlock that market side of things to reach those that can't afford it, need that aid at the same time. I just need to tap that, there we go. So are we focused in the right area? It's not that the 600 million that live on less than $2 a day, we kind of know the stats. It's not that they're not important, but how do we reach them effectively? Are we focused in the right areas by only focusing on them? So the proposition that we also often come from is this, we talk about 2 billion people don't have safe water. They don't have safe water in their home. There's lots of stats that go up to 6 billion don't have consistent safe water in their home every day. So there's big numbers around not having safe water. But we also know extreme poverty numbers, which say those that live on less than $2 a day is 600 million people. So somewhere in there, there's an equation that says there's at least 1.4 billion that have some means, and they're a market, but they still don't have safe water in their home. They still aren't where they want to be in their home and health and education, everything else that they can be, but they have more means than those in extreme poverty. So who is this 1.4 billion? Who are they? They are the teachers, the nurses, the small business owners. They're people that have income. Their value of health is high. They understand the problem. They understand they might not have safe water. They don't necessarily need to be educated and informed on what they need. They just need access to it. These are the people that are available. They're in our communities, in the communities around the world. So this market price model, Business Tech does this, other people do this. The commercial world, the private sector does this to reach all of the world with its products. So the humanitarian space, the aid space can use that same thing. So starting with that market approach, who's the consumer? What do they want? What's the aspirational feel, touch? They want piped water, but their piped water's not consistent, so they want safe water to be able to drink for their kids. The mom wants to supply that. Being focused on that 1.4 billion as a customer base and not as a need of aid base. Bring that down into generating the margins. Margins create impact. You'll hear me talk about that a lot. A margin creates impact. Aid also creates impact, grants and impact, but margin creates impact in the greatest way because it's sustainable. It is not reliant upon the ebb and flow of whatever political environment there is, whatever else is going on. There is a margin that's built in. So having that, the ability to be able to, the 600 million people that need it, that's subsidized, or they need a voucher program, or they need programs that money needs to plug into. I loved Gary's quote on Monday, which was, getting water is money. Money has to flow somewhere, whether it's the volume that I spend in sweat equity of walking everywhere to get it, or if it's money that I have because I'm a middle income person. And so being able to discount that and take physical money out and give them access to it is that full loop of the market approach. You know, this is seen throughout, this is a few examples. I mean, there's hundreds of solutions out there, but anywhere from $1 to $500, whether it be a simple VF100 that in country is $30 for a 2 to 7 year, water filter, to, single strips of an Aquatabs, that has 10 strips. That's 5 gallons per strip. That's 50 gallons, 50 liters of safe water with one strip. Extremely affordable. There's some examples that we're doing. We're really easy examples. ShopRite in South Africa and moving stuff like that. How do they put a simple strip in that's affordable, that somebody can have water for their family for a while, for Rand 5, Rand 6, which is pennies, to be able to have that access. That is margin in there, and then we can take that and work elsewhere. But there's everything up to whole household filters, like the Water Roam. There's, surface water, the P&G purifier. We know a lot of these products, but utilizing the market to come this way. Aquatabs in the US for the outdoor community, that's great. There's 60-70% margin on that. You can turn that, and that margin makes impact. So that's part of what Business Connect does. Our bottom line is nothing, because we can use that margin to make impact. We use that margin to supply people going to Jamaica soon. And that's part of what we do all the time, in using that market and then using that margin to make impact. But of course, there's no one silver bullet. So I'm quick to say this, that we represent a bunch of products. There's hundreds of other products, and part of our job is to vet what's right, vet what is good, what's not. Whether it be the WHO scheme, whether it be NSF or ANSI, there's lots of ways to make sure that the right things are in the market, and I think that's important, but there's not one that works right. In Bangladesh is a very different issue than in Panama, that doesn't have safe water in their pipes. Two very different issues, 2 different solutions, 2 different markets, 2 different customer bases, and that goes to every community, not just to every country. So part of what we do, and I offer this to you, it's out there on our website and free. There's almost 400 different solutions. So if you scan that, it goes to a full database of all the solutions that we found out there, and we're adding a ton constantly. It is consistently updated. And the neat thing about this is we wanted to do this not out of grant money, so we didn't get a grant to build this solutions database. This is out of margins. So being able to provide the WASH community with full solutions database, it has hygiene on there as well, so there's 50, 60 hygiene products as well on there. Hope to move into the full WASH, gamut of solutions, but being able to do this through the market, through margins, and supply things like this, so you can know about that. So really important to know what's right, because there's not one right solution. But I appreciate it. On a Thursday, you guys are all here. You guys are all leaders in your space. I've met a lot of you along the way, looking at faces, and you're doing the work. And so it's fun to either come alongside of you on the aid side, because that's necessary for the 600 million, but how do we do this full circle and create margins where you're meeting people, whether you're doing development work or on the technology side, to make sure those are going in places to create a margin, and not just dropping aid where maybe there's a margin that could be there, and having that appropriate cycle, because there's lots of ways to break the market too. So, thank you for your time, appreciate it. Thanks, Jamie.
We actually have time for a few immediate questions for Jeremy, but then some more questions at the end.
Yeah.
Mark Sobsey. So, obviously, most of the suppliers of HWTS technologies in the marketplace operate independently. Is there any effort for those people to come together, sort of like the Bottled Water Association in the United States, so that they can assist each other, help each other, share their experiences, and overall enrich the effort so that more people can get access in the future?
Yeah. Really good question. And we know over the years, HWTS was really strong, and that alliance was really strong of manufacturers and people involved in that. You know, that's now headed up by Cost. Cost does a great job of handling that network, but there's still a lot of necessity, and I'll come back to this. There's still a lot of necessity to kind of bring all those actors to make sure testing is good, make sure quality is there, but also to bring access to all the distributors, bring access to countries that aren't open to one manufacturer because they don't know anybody, but another manufacturer would have that. And this isn't a competition, it's not a silver bullet. And so there's a lot of effort going in. We have a section of this platform which is for consultants, we have a section of this platform which is for actors in the space, and to be able to collaborate. We need more margin to build more stuff, and if you had someone want to give us a grant, fantastic, but that's not our model, and we're building that margin to really build that network. So Mark, I appreciate it, because there's a huge need for that in the sector, to have kind of collaboration amongst the HWTS actors. Yeah, thank you. Yeah.
I have a question in those lines of water, and I love the technology resources. I'm wondering what shared resources there are for the enterprise teams in terms of sales models, actual tools, financial management, marketing, use of digital payment systems. Is there a resource where there are shared tools available to expand enterprise models?
Yeah. I love it, because that's and you guys do a great job out there getting it out there in a lot of different ways without a silver bullet, and I love that. Right now we have a knowledge base. Our marketing team works with the manufacturers that are in our network, so it's the biggest encouragement that, you know, come be a part of that Business Connect network. There's no cost to that. It's a part of being a part of us, and we don't onboard every manufacturer, so let me forewarn that takes time, but it's those kind of tools that we do, and that we collaborate with that when there's margin to be capable in that piece. So that's one thing. There's not a good resource of tools out there, honestly, on that thing. One of the things we want to do in our Knowledge Hub is to be able to incorporate some of those market tools, whether it be a simple PowerPoint around, you know, dollar savings, you know. And we have some of those resources, and we love to share that. So I will say, network in, you know, come talk to anybody here. Michelle, our CMO, will gladly share some stuff. That we've got a great deck in Ghana about the change you save every time, instead of buying a sachet, you know what it is. And those kind of resources are out there, and I think all of us have about 5 or 6 of them. So yeah, sharing those is really needed. Yeah.
Hey, Knox, Duke UNC. I've always been curious how much, so, you know, operating on margin, how much is eaten up by these kind of third-party distribution, parcel carriers, shipping, customs, kind of the act of just getting it into the country?
Yeah. And it depends on the channel, honestly. So we do a lot of heavy digital. That's 15 to 20% just gone. And that's in, you know, Take a Lot in South Africa to Amazon in the US, everywhere else. Logistics side, you're probably only 10 to 15%. Obviously, that's exclusive of VAT and duty. Madagascar, you're at 80%. Honduras, you're 35%. South Africa, you've got other, like, that matters. So certainly it cuts into margin, and that means, for us, we create a global price on products, and then every country is a big range around that. So that's how we factor it in. Our distributor network, we really try to have them be at a 20% margin rate, and so it's not your typical, you know, 50% margin for a retailer. So when we understand that, these are life-enhancing products, that's why we're in that market, so we're pretty tight on our margins, honestly. And we always say, like, nonprofits try to operate on a 15% administrative budget. That's what we try to allocate to our margins for people, so, yeah, good question.
Thank you. Thanks, Jeremy. I appreciate it. And thanks for those warm-up questions too. I also just realized I didn't introduce myself. Sorry, it's early. I'm Jamie Harris. I'm the CTO of Silvier Technologies. I actually used to work with Jeremy and Michelle at Business Connect, so I'm very biased, but the solutions database is great. I did help curate a lot of it. But next we do have a video of Water by Women, and then Lorraine will be on Zoom to answer a few questions after the video. So I will attempt to get these. Nope.
The great resource that's out there is really love. To leverage that is the answer to this problem. Love is what makes this work. It's love of children, it's love of family, it's love of neighbor. And every community out there has women who are ready to do that. In about the year 2000, it's been about 24, 25 years now, was the first time I ever came to Honduras, and I learned what a pila is. What's a pila? It's a big open tank where most people collect water and where water is delivered. And I was walking around in a village, and the host, a priest, said to me, that family over there was going to invite you to supper, but they've had to withdraw their invitation because their little girl died this morning because of dirty water. A 2-year-old child died because of dirty water. And I was so taken aback. The only prayer I could come up with was, I have nothing. I don't know what I'm doing in this picture. I don't know anything about water and how to provide that. I have nothing. And it wasn't until maybe 5 or 6 years later that I was coming back to Honduras with a medical team to do medical missions. And my friend Arnie and I were standing looking at a line of people standing in the sun waiting to see the very few doctors we had. And Arnie said, you know, if we could bring clean water into this neighborhood, it would eliminate half this patient load. And I could only say, so how are we going to do that? And that's how we began finding Water by Women.
We tried a lot of different technologies, and we researched in cooperation with the women in Honduras. We asked questions, they trusted us enough to tell us, and we looked at different things from wells to different filtration systems to infrastructure.
All of those desperately thirsty people have one common resource that is untapped, and that is smart, caring women. And they're at the point of use. They're at the point of the problem, which is small children in the home drinking dirty water.
And what they really wanted was something that would work inside their own homes, something they could control and manage, and something that required only gravity and their love for their family. And that's the filter system that we're using.
So what we do is we equip women with the best filter that money can buy, and we train them how to use it correctly. And then we ask them to each be responsible for 3 other families. And we do that because the need is so huge that we just want to reach more of them as quickly as possible, because we want to prevent the death of their children. And so you put a filter into the hands of a woman and you give her a purpose, and she will change her world.
A mother's love is crucial to making this water program work because it's guaranteed, it's automatic, it's unchanging, and it is very, very powerful.
Love is what makes this work. It's love of children, it's love of family, it's love of neighbor. And every community out there has women who are ready to do that.
We now have almost a complete generation of children who've been raised on clean water in some communities, particularly this one here in Honduras. And the change is obvious and visible to even a non-trained eye. These are happy, healthy, vibrant children. We used to see a lot of pain and suffering, and that's just not here anymore. I never had the skills to help them as a physician, but I did have the skills to help them as a human being.
With the approach of Water by Women, it's simple. It's really easy to do. It takes a little bit of organization, but we can, with very little funding, go across an entire community and in 8 to 10 days, have everyone there drinking clean water.
We started in Honduras in an effort to eliminate health problems in one community, and we began with 10 water women. We've grown from that point to where we have partners and water women in more than 40 countries, and it works everywhere, regardless of language, regardless of religion, because mother's love is a universal, divine, constant thing.
I really believe that God takes delight in working with the least likely to succeed, in turning someone onto a problem. And I just have seen that happen over and over. God can use all of us, and God is not dependent upon our credentials, our academic achievements. If God can use me, God can use anyone.
The problem of unsafe water is so big it feels impossible to tackle. But it's a real dangerous thing to teach people that you have to be special in order to change things. You don't. You just have to try. We started out to help just a few women in a small community. We found out that it worked, and we went on to do more and more. And we found out that it is possible to solve large problems with simple love solutions. A mother's love is what makes this work, and it would be a mistake to underestimate how much that kind of love can change things.
Awesome. I'm going to bring Lorraine on the screen. One second. Hi, Lorraine. I'm slowly getting you on the screen here. Oh, if you unmute yourself, then we can.
Yes. Hello.
Awesome. Thank you. What a lovely
I'm not
video.
I'm not sure about those two clips from the end of a Zoom there at the end.
Yeah. It must be
Whatever, that's our former
Yeah.
Haitian country
Oh.
coordinator.
Yes. Well, we have time for a couple of questions for you, Lorraine, before Hank presents. Does anyone have a question for Lorraine? Comment? Yeah.
Thank you, sister. Can you hear me?
Yes.
Wonderful. My name is Tebaldo. I work for the Vatican. I was very impressed by your video. The two main questions would be the liaison with the local church, where the parishes or maybe the diocese are supportive.
Yes.
And the second question would be, since this panel is chiefly dedicated to the financial side, what would be, let's say, your way of financially supporting this kind of filter? And again, thank you very much for this very inspiring work.
Thank you. Thank you. I really hope that we'll be able to exchange contact information. And so will that be possible? Whoever's in charge here?
Certainly.
Yeah, we'll get it.
Okay, great. Thank you. We follow normally a sponsorship model, even though we do a lot of grant seeking, that kind of stuff. But we normally run a budget for whether it's a large scale grant or a sponsorship of one water woman based on a certain amount per water woman, which covers everything, unless there are super extraordinary, special expenses. This year, it's been $80. So that's one woman for every 4 families. And we do have a lot of liaison and work with the different churches and dioceses. It depends on where we are. We started in the diocese, the Archdiocese of Tegucigalpa, so we have great relationships there with Cardinal Rodriguez and for Natcher, the new Archbishop. And a long time of experience there. So we essentially just find support for what we're doing for a particular community and then go in and begin the process.
Thank you.
Thank you.
So I understand there's no contribution from the local families. Hi, sister, this is Tina Owen. I'm with a group called Mind to Water.
Mhm.
And on that sponsorship model, is there any financial investment from the water women? Would be one question.
Yeah. It's a good question, and I know it comes out of a certain frame of mind. Remember at the beginning of the film, we're saying the great resource is love. People are making a contribution, and they're making a contribution, honestly, when it comes to time and energy, that is a financial value. All right. So their buy-in, they agree at the outset that they are publicly known if they are chosen. And we do drawing of names, that they are publicly known that they will filter water for their other families around them. So it's a pretty heavy investment on their part. I would say it's an investment that's worth more than financial, but it also has its financial implications.
Thank you. Thank you. I appreciate that. Thank you again. Yeah, we have time. Yeah, Mark.
Mark Sopsey, University of North Carolina, and co-founder of Aquagenics. One of the great challenges in providing household water and safe storage is how to sustain and maintain uptake, since there is evidence from the literature that sometimes, with all good intentions, people abandon the filter that they have, or the filter breaks, or some other happenstance undermines their ability to maintain a system that has been providing safe water in the home. Is there an approach to that which you have found to be successful?
Yes, and I think our friend from the Vatican would understand this. And we are working with human people, okay? We are working with human beings like all of us are. When we are working with people who have made a spiritually based commitment, now we say we don't do this denominationally, they make this in their hearts. But when we're working with people where we have that kind of foundation for commitment, then that tends to, first of all, it is supported by God, and it tends to endure. It tends to endure. Especially, I will honestly say this, in areas where the stakes are very high. We have amazing outcomes in Haiti in areas that we have flooded with water women that no longer are threatened by cholera. And that would be years later without any ongoing interference or supervision on our part. And cholera, it's sudden death almost, and it tends to focus the mind, the threat of it. But it really all comes down to saying to these women, you're going to be superheroes for your community. You're already heroes because you are loving mothers. You're superheroes if you're willing to extend that to neighbor and you're willing to be known for that. And there, comes into play a support, a spiritual support from God and a community support and regard. There's an empowerment happening at a very deep level for the women in their community. So there's no one guaranteed moment there, but you're looking to build in all the factors that bring out the best in the human being as we were created to be.
Thank you.
That's beautiful. Thank you, Lorraine.
Thank you.
Let's clap her out now. Thank you, Lorraine.
you.
Yeah, we'll have time for more questions, but I do want to move on to Hank's presentation, From Pipe Dream to Filter Reality. I'm gonna find my mouse here. There we go, and I'll get that into the presentation.
Yeah, thank you for coming. So I'm Henk Holslag. I'm a retired baby boomer. I'm still advising the MetaMeta Smart Center Group, which is a group of WASH training centers in 10 developing countries. And we focus on training with local materials. So focus on producing locally well-doing technology, pumps, solar pumps, filters, storage, a whole range. So I would like to discuss how we can get safe water for all in Africa. And we all know the problems with the quality in the rural areas. A big problem in rural areas is when there's transport and storage, a lot of recontamination happens. In urban areas, one of the challenges is, for instance, water sharing. I know in Addis Ababa, many parts of the city have only 1 or 2 days of water per week, so people have to.
Sorry.
You can put it in the corner maybe.
Yeah. She'll be watching you over here.
Yeah, that would be nice. Okay, so so people, when they have water sharing, you have to store water, and that can contaminate. So, you know, the SDG 6 safely managed indicator is on premises, 24/7, and safe. Now, how many of all the water utilities in Africa can comply with this? Who thinks it's 24%? Who thinks it's 21? Who thinks it's 7%? The reality is we don't know. This is not based on studies. This is based on impressions. I've been to many forums, conferences in the last 5 years, and on each conference we ask all the people that we meet, who do you know in your country companies that can guarantee safe water from the tap 24/7? And guess what? Even the people from the water utilities themselves say, I don't know. So, we have a big elephant in the room. We all know, but we don't discuss it. So, but there is a solution, and this is how does water treatment. In 2007, the WHO had already a study that says that if you have household water treatment and you use it consistently and continuously and combine it with hygiene, you reduce waterborne diseases by at least 50%. I was just reading the handout from Water by Women, and I see that they say that the reduction of diarrhea is 75 to 90%. And whether it's 50 or 60 or 70, it helps. If you do it right, it works. Also, this study says that if you invest in this, you may have benefits of $5 to even $60 per every dollar invested. So you would think that all the ministries of finance of all the countries in Africa would jump on this. This is a business case. I invest $1, I may get $5 or more dollars back. And guess what? Nothing happens. Household water treatment did not scale up the way it could have. So there may be reasons. Maybe one of the reasons is there were failures with all the projects with household water treatment. Chlorine is very effective, but people in Africa don't like it. And it doesn't eliminate cryptosporidium, which is the number 2 baby killer in Africa. Boiling, very effective, but it costs money. And it's not a custom like in Asia. Many people boil water. In Africa, much less. Filters. There were filters. This is an example of a failed project in Kenya. 900,000 filters were given away for free. Very good filter. But it was difficult to maintain. It was not user-friendly. There was no supply chain for spare parts and new filters. And there was no ownership. So it didn't work. On the other hand, filters is a multi-billion business. Google on water filters and you find an enormous amount of information. There's inline filters, if people have pipe systems, there's gravity, all kinds of gravity. There's, in the US, over 95% of the people use some kind of a filter. In India, that is about 50%, but Africa is lagging behind. There is also filters with a larger capacity, and all this knowledge is there with Business Connect. So the big question is, how do we get this market-based option to the poor? And we think that we have to invest largely in 3 things. One is the behavior change, the work that Water by Women is doing, investing in talking to people, understand that clear water can still be dangerous, understand that you can have recontamination, understand that you have hygiene, that you need clean hands, etc. And this has to be done long time, large scale, social media, TV, whatever. Then number 2 is build up supply chains of affordable options, a range of options. So in every village you should be able to buy the treatment options like Jeremy was mentioning. And the third one is the most important probably, is we need to support the poor. The poorest need subsidy, it's simple. So there's 600,000 or the 6.6 billion people that are really too poor, they need a subsidy. And then the people that know about subsidies will say, but subsidies distort the market, which is true if you don't do it the right way. But if you do it in the right way, it does work. We give an example from Malawi. An organization had money and they wanted to help poor families with a filter. But then the question is, who decides who is poor? How do you see somebody is poor? So they decided to work with pregnant women because then it's easy to see, right? It's to see the target group is visible. So they gave a voucher of $20. With this voucher they go to the local shop and buy a filter of $23 that is available commercially. So the shop that did not have filters before now has filters that they also sell on a commercial basis to other people that do have money. So if you use subsidies in the right way, it can help to build up your market and supply chains that you need to supply the other part of your target group, the part that Jeremy was talking about. Now, the $4 per person. So we say that on average it should be possible to have, with a $4 investment, save water. And an example is just mentioned by Laureen. $20 on average, $80, which is for the filter, the behavior change, and the overhead. So $4 per person, one-time investment. So if you would copy paste, nothing is easy, but if you would say copy paste it to Africa level, and you would have 600 million people that need this subsidy, then you would need 2.4 billion for the subsidy. And if you invest another 1.6 billion for behavior change, you have $4 billion. $4 billion is a lot of money. But the African Union recently said that they needed $100 billion to create Safely Managed. So it's just 4% of the budget that you need for this complete Safely system. So again, filters will not replace the supply. You still need pipes, you still need wells, you still need tap waters. It will just make the water that people drink safe. An example of scaling is Ethiopia. Ethiopia, in a new national policy for the next 5 years, included self-supply and including household water treatment as a priority. And what is interesting in Ethiopia also is that over 50 utilities and 100 water providers now promote household water treatment and even sell filters to the clients. It's not to say we cannot comply, it's an additional service. See it as an additional service to your clients. So we think that Ethiopia is an example for other countries. This could be done by other countries also. And another condition in Ethiopia is local production. So with local production, you can reduce the cost to a maximum, you create labor, and you make things more affordable. And this production of, they have produced 600,000 filters already. That was started with just $500,000, aid money. So we should go on dreaming about pipes, absolutely, but let's be realistic and promote household water treatment as an intermediate solution. And a few actions that we suggest is that governments include household water treatment in the national water safety plans. So invest largely in these three activities: behavior change, supply chain, and subsidy. And NGOs, please stop giving filters for free. Although Water by Women is giving for free, they still have the commitment of the women. But in general, if people pay a little bit, then they feel even more the value of filters. And if you want to build up a supply chain, use a voucher system. And then we always have the question, who is going to pay? Who should pay? I think everyone that wants to comply with the human right of water should pay. That can be governments, it can be NGOs, it can be donors, whoever. So I have a proposition. If utilities or water providers cannot guarantee that water is safe 24/7, they should promote household water treatment. Who would agree with this proposition? Nobody agrees. 2.5.
Sorry,
3.
your slide says who does not agree. Is it?
Oh, sorry. I was not, okay. Thank you very much for the correction. So, who will not agree with this proposition? Can I see hands? So everybody agrees. Wow, I never had this before. So do something about it. Thank you.
Thank you, Hank. Yeah, we will have time for disagreements too, so we want to hear those as well. Next, we're going to move over to a panel discussion where I have some questions prepared for our panelists, Hank, Jeremy, Lorraine online. Is Lamessa, do you know if Lamessa's joining us, Hank?
Yes, I'm
Oh, okay, great. Nice to meet you, Lamessa.
Thank you.
Yes, yeah, come sit.
Thank you.
Yes. And Lamessa, would you like to do a brief introduction of yourself before we start panel questions?
Okay, thank you. Nice to see you all again. I'm Lamessa Makonta, IFSC Wash Ethiopia Country Director based in Addis.
Thank you. And I'll have Lorraine joining back here. Okay. I will get to the online questions in a little bit. Just close those for now. Okay, great. So I will start with you, Lamessa, just because, you've just introduced yourself. That's fresh in our mind. So I would love to know more about self-supply in Ethiopia. What does that look like currently? Are there any subsidies being done in Ethiopia? Yes, no, any explanations?
Good, thank you. This is a broad question, but let me try to reflect on it. I wonder how many of us really knows what self-supply means. It could be for water, it could be for sanitation, it could be for any individual or public services we are looking for. But for this session, I will focus on water and sanitation. Self-supply, it is like a kind of self-financed services, either fully or partially. Coming to Ethiopia, self-supply is acknowledged and endorsed by government as one of water service delivery models in 2011. By that time, government decided to address the then unserved rural population of 30% of underserved rural population to be addressed through self-supply. This is roughly estimated as at least 15% of the current rural population of Ethiopia, which is around 100 million, the rural population, but the entire population is 130 million. So you can see how big the potential is to serve the underserved rural population in terms of water supply. Based on this, in 2012, the government, Ministry of Water and Energy, endorsed self-supply policy guidelines. And in that guideline, there are two categories of households. One, individual household who can finance or who needs to finance their own water supply. They are eligible only for technical support, guidance, advices from government, from NGOs at local level. The second categories are groups of households. If there are at least 10 households in a rural area and they can apply for subsidy, there are criteria for that subsidy. Number one, the minimum number of households who can apply for that are 10. Second, they are eligible for a subsidy of up to 50%, 50% of the total capital investment of the infrastructure. The third, eligible components of that infrastructure are industrial products that are not available locally, like cement, hand pumps, and other components that are not available locally. So, based on that, groups of households in any parts of the country can submit their request to local government and can receive that subsidy. Another aspect on sanitation I need to reflect as well. In 2023, recently, like 10 years ago, talking about sanitation subsidy was a kind of taboo in the country. But in 2023, government approved sanitation subsidy protocol, which is called Smart and Targeted Sanitation Subsidy Protocol. By smart means like a subsidy that doesn't distort local market or the market-based approach. So we can learn a lot. There are different criteria in terms of identifying who is eligible and who is not eligible, and what components of the sanitation infrastructures are eligible for the subsidy or not. What makes different for sanitation is, unlike in self-supply or water supply, the subsidy is from 20 to 80%, 80%. The remaining proportions of the total capital investment needs to be covered by households. Thank you.
Thank you for all that information. That is super helpful to know. I'm curious too, you said that for the water supply subsidy, it's for infrastructure. Is that mainly wells that you're seeing?
It depends. By self-supply, again, it is not limited by groundwater. It includes rainwater harvesting. Could be through roof rainwater harvesting. It could be spring. It could be surface runoff, including a small pond. That is number one. Number two, again, there are packages in it. It says in the policy guidelines, investment to improve or to have clean water, which involves pumps, and there is also a debate whether that includes household water treatment like filters in it. So basically, it involves every source of water supplies, not limited to wells. Yeah.
Okay. That's great to know. It's all inclusive of any way that they can get safe water, and it's so highly subsidized. Very cool. Jeremy, I had another question for you as well. From your standpoint, because you come from the more market-based approach and having the a commercial, non-donor-driven market, what have you seen is the single biggest barrier to scaling that? And that's a big question, so.
Only a single one?
You can list a couple.
You know, it's hard when you live on the margins because there's not always enough margins. And so there is certainly that aspect where when you're working with distributors, do they have enough? Do they eat their profit or do they build their business? And so I would say one of the large issues in that is people's livelihood is based in selling the product, or people's livelihood are based in those things. And so it is a very hard approach because you can no longer just work really hard to bring water to a community. You have to sell a product. And so there's a lot more result-based orientation versus effort-based. And there's nothing wrong with effort-based, and so please understand that, but there's a different dynamic when it comes to market-based approaches. I'm here, I enjoy the aid community, we want to support it, but there's a difference between reporting that we made these efforts and a I sold this much so I could feed my family. And so working with those margins is probably the largest challenge, to really come alongside people and how do you do that? You know, financing the distributor so they have means to do it, so they can have product in their shop. There's lots of ways to answer that and solve that, but none of them are easy. So I would say that's probably one of the biggest factors in it. And the other side of it is being customer centric. You know, products are designed to help, but being aspirational, those kind of things are sometimes the second thought to price, and they have to go hand in hand. A product that looks great, that feels great, somebody might spend a few more pennies on than something that works and practical, and there's uptake because they like to see it in their kitchen, and that's important. And so I would say those two things are a big part of the challenge.
100%, that makes sense. When the margin isn't enough, you have to work with what you have. One follow-up question, because we've heard a lot about filters by both Lorraine and Hank, which I think are fantastic and they save lives. Do you see that a market for non-filter technologies, including Aquatabs, the Madi Drop, P&G sachet? There are non-filter technologies out there. Do you see a market for those as well?
We do. We actually see a good number of, this is where there's not a silver bullet, because we talk in Africa about, you know, the taste of chlorine or the effective difference of that, and that does matter. That's part of meeting the community. But Madi Drop's a good example. It doesn't affect the taste. A lot more longevity, really good price point, and an easy entry price point. And that's where treatment sometimes is that easy price point entry. Aquatabs is this way, where your entry point is a lot easier for a family to purchase. It creates a margin that purchases a consumable. It's why people rent as they're moving out of poverty. They rent for a little while and they can move and they can transition to a larger filter or something that's longer term. So treatment really allows for that transition. You know, in other communities, Latin America, chlorine's really accepted. You know, those things are accepted. So you have to have your context right, but a lot of times that entry point is treatment, because treatment typically is less expensive at the entry point. It might be more expensive, you know, if one filter lasts 10 years and you can have it forever, but you gotta spend $60 US on it. That's a big lift. But if I can spend 50 cents a week on a treatment solution and build towards that, that's where distributorship comes in. That's where the relationship selling, that's where having that supply chain fully integrated matters. So there's a lot of need for treatment, a lot of capability where that comes in.
Yeah, no, that makes complete sense. That upfront cost can be a huge barrier. And that does relate to what some of Henk has said with subsidies and Lorraine's model with having their time and energy be the payment. And that does transition me. I did want to ask you, Lorraine, the Water by Women model is very fascinating. I'm very interested. Costs $80 for 20 people by empowering a water woman. And your data shows that filters are still functioning after 15 years. What is your key to that longevity? I know you touched on community in your video, but just curious for any other thoughts on that. Oh, you might need to unmute yourself, Lorraine.
Sorry. There's a lot of different things, as I said, that do support that, you know, overall. One of the big things is very intensive training. We do a 4-hour session that's kind of designed for the typical village woman's day, and held to that, but it includes some of that basic household, you know, the whys, all that kind of stuff. Hands-on actual practice with the filters, decorating their buckets, the things that just kind of build ownership and a sense of dedication and purpose, a lot of conversation, a lot of fun. So that training is really important, doing that big investment into that. Yeah, and we say to them at the outset, if you agree to this, you're going to get one filter. That filter, so far, we've had them last 15 years. It's potentially a lifetime. They're extremely durable. if you take care of it. Why would I give you a second filter and deprive another woman of her first because you won't take care of it? And what we're doing is speaking to these women at an equal level of dignity, not a poor you, I hope you'll understand way, but a you got this one chance, you're smart, you've declared yourself caring, step it up. We are not going to invest in supervising you, babysitting you, or in providing you with another filter when you didn't take care of it. The one thing we do invest in where we have that capacity is there'll be somebody local to, or, our local team will be able to help women who've not taken care of their filter properly. And so they need some, rehab and a little retraining. Sometimes we do some of that. But we do appoint local women as well to kind of be the lead water women who are there as a resource for others. But we don't invest in them financially. And again, we say, you get one filter, take care of it. Some other woman's child could die because you wanted a second filter. Would that be fair? No.
Using the social, I don't want to say social pressure, but kind of social pressure, but
It
the
is a
work that's
social,
put
it's a
out.
social expectation. It's an expectation that you are of equal human dignity and intelligence, and you can get this if you think about it.
Yeah, empowering versus charity, like you said. And the word that stood out to me, what you said was fun. It's a
Yeah,
community event,
yeah.
and people are connecting and they want to be there. And I don't think with every single aspect of water and wash it could be described as
Yeah.
fun. So
We
that was
actually
really
do use we have a superhero theme now for the Water Woman training. We have capes.
that's awesome. Love that.
It
Thank
does
you.
make it fun. It just, everything that, supports it.
Yes. No, thank you, Lorraine. Appreciate that. I want to ask Hank one last question, and then we'll open it to the audience because we're hitting a lot of different points, and I want to hear everyone's thoughts. Hank, you mentioned the voucher model in Malawi. Can you explain again how that voucher model could build up a supply chain in the market, and how can we help create and sustain that?
Yeah. Well, we have the experience with bed nets. 20 years ago, there was a huge voucher system, as far as I understand, for bed nets. Mosquito nets to prevent malaria. And of course, we all know that many families started to use the bed nets for fishing and then putting it in the garden, etc. But some used it for the children, and now in every country in Africa you can buy bed nets commercially. It did build up a commercial supply chain. So I think we could do the same for filters. Of course, you need to find out how, but as I said, in Malawi with this project, the fact that the shop in the local village in Livingstonia, it was in Livingstonia, it's just a small shop that sells some food. They never sold filters. Now they sell filters on a commercial base. And when there's a donor, they get 50 or 100 women that come to the shop and buy a filter with a voucher. So in this way, you build up a supply chain in a village that never had filters before. Does that answer the question?
Yeah. I wrote down bed nets because I was curious because you had mentioned that in one of your slides, so that does help with referencing. Well, thank you all. Those we have more backup questions, but I do want to hear. I'm gonna open up some from Zoom, and then I'll open up some from the audience here. Oh, let's see, maybe it was in the chat actually. Okay, I'll start. Okay. These are mostly for Lorraine, which is great. Lorraine, do you want to speak to Aline's question here? Oh, did you already respond to her? Maybe at 9:04.
I believe I did respond to her.
Yes. Let's ask, are there any refresher trainings further down the line? And you did mention briefly if it's needed.
Yeah. And if it's possible, we're always having to triage Resources relative to the huge scale of need, which literally means, as we all know, the death of about 1,000 children a day. So, where do you put resources? Do you put them in an ideal program, which we would all love to do, kind of like we would all love ideal pipes? Or do you put them into getting more filters to women in a responsible, supportive way? Which way do you do that? So we do, it just depends to what degree a program is developed in a particular place as to whether there's a more formal source of, of resource for guidance but we don't say, oh, your filter has died. Um, yeah.
Okay. No, thank you. Thank you for answering that. I would love to hear from any in-person audience if you have any questions. Yes, Mark.
Mark Zopsy again from UNC. So a lot of the focus has been on the hardware as well as behavior change. One of the areas that has not been considered very much is safe storage.
Mm-hmm.
And storage systems can be quite different depending upon what type of technology you use to try and produce safe water. Also, whether or not the storage vessel itself is highly protected from water. I noticed that in Haiti, it's an open bucket. That's not really a safe storage system. And then that means the water has to be handled. And handling often leads to microbial contamination. So I think this is an issue that deserves more attention, looking at how to assure that treated water, by any means, maintains its safety during storage and handling. And we have documentation from studies that I was involved in Bangladesh showing that people who collect water from a source in a storage vessel like a coal sheet, which is there's one on display out there. It's a stainless steel container, maybe 10 or 15 liters, and it has a wide open top. That's the thing that is not safe because children can put their hands in it, vectors can have access to it. So I think some emphasis has to be put on designing robust technologies that provide for safe storage.
Looking at the full picture of the life cycle of how they're using the water and not necessarily just treating.
Particularly for water that is filtered with no disinfectant, right? I mean, if there's a residual disinfectant like aquatabs or silver or something like that, that helps it tremendously. Or at least having the container that's safe.
Yeah, maybe Hank first, and then I think Lorraine wants to say something.
Well, this is a very good point. As you know, COST is promoting what they call the multi-barrier approach. So if you have a pot filter, for instance, or a biosand filter that gives water into a container, they say you have to put in chlorine also afterwards to make sure that it's safe. Well, we have this, the muddy drop and the chlorine tablets too for the storage. Also, some filters are treated with silver, nano silver, and that leaches out a little bit of silver into the storage container, and that prevents recontamination. So it depends on the type of technology, but it's a very good observation.
Yeah, Lorraine, if you want to, Lorraine, you can go next.
Thank you again. Great points. One thing to keep in mind is that if you're using a filter with a decent flow rate, at least at the household where that filter is, there's more a point of use, immediate point of use capacity. But secondly, we give out a 2-gallon sealed pouch, okay? So that the water is stored in something that's sealed, that has a screw-on lid, that at least prevents recontamination. It's going to, it's very highly filtered water. it's not going to immediately begin growing something, especially in an environment like that, that's constantly being re-rinsed out. And so, and I'm very concerned for the issues of children putting their hands in buckets and drowning in buckets. A toddler, as we all know, can drown in a few inches in a bucket. So yes. Important.
Jeremy, did you have a thought?
Yeah, I was gonna add on that. I think this is part of the consumer-centric approach too, because some communities have water storage already in their community, and that's part of what they do, whether it be in Colombia where, you know, if you're in the Llanos, your water only turns on, you know, one day a week, and so of course you have to store. But what do you do with that? So is it meeting that community in their context in the Congo where they have a pot that sits on cold stones and then they switch it to another pot? And these communities can be met with a particular solution that meets that need, whether it be a Mali drop where there's already storage there, we know that's residual. I think there's some community education and things where covering the water, things like that can be added, but if you meet it where it is with the right solution for that community, the uptake is already way more natural to what they do. So if it's if they're used to storage, how do you enhance that? If they're not used to storage and they have pretty good access to surface water, that point of use makes more sense. If they have access to, so determining some of those things and going in, for us, that's a distributor, that's a local person that goes, here's how they've been doing water for 20 years. How do I sell into that community effectively, healthily, but effectively to meet what they, so there's less change, less behavior change, less, less friction to the purchase from that standpoint. So.
Yeah, the customizing the solution to the community and not trying to fit it the other way around. I do like that. No silver bullet. Very cool. Any other questions from the audience? Yes.
One of the last slides of Hank had a comment on human right to drinking water. So you said the government should be ready to do something, which is so meaningful whenever we have a customer-centric approach or any market approach. Is this something which is frequent in, let's say, in the countries in which you work? I ask this because quite frequently it seems that US invented strategies stem from a country which is not quite active in promoting at federal level the human right to drinking water. This means that smart approaches are promoted, and occasionally this may land in a country where there is a strong culture of the human right to drinking water. Oh, why are you promoting a business approach? This is so. Please.
No, I completely agree with that, and I'll come on that because it is part of that balance of this human right, and it is a really good example of something I've always dreamed that the Vatican would take on. Is every parish in the world has vouchers. Every parish in the world knows who's struggling in the community and who has the means in the community, and to do something like that and come alongside of that. There are integrated networks in every community that know who needs help and who has some means, and to be able to work within those networks in a very culturally intelligent way. I just had a conversation yesterday. Cultural intelligence for us is one of our biggest values for our staff, our biggest values where we work. If you don't know that in Africa you don't necessarily get a yes or a no, you get, they're a softer culture. If you don't know if when you're in Asia you have a very different communication style. If you don't know what you're coming into, being consumer centric, it can't be the US coming in with our ideals and our market approach. I don't use these terms if I'm in a country. It's dramatically different. I'm coming alongside of humans saying, how do we do this together? And so it's a really good point. At a conference like this, it's a little more direct. I'm very direct if I need to be, but there's a culture appropriateness where you communicate in different ways in different communities and cultures. So, does that answer that question? I mean, that's a very hard part of the cultural side of this.
May I reflect on this
Yes,
one?
please.
Yeah, I like your question again. In water management policy, in water resource management policy of Ethiopia, just as an example, it indicates that water is both social and economic goods. The social good aspect is related to what you have raised now about the rights. The economic goods, someone has to pay for the services. The question is how we can address these a little bit contradictory things. Looks contradictory, but there are always ways to address those. In any country or in any community, we can find three segments of people. The poorest of the poor, who can't afford to pay for the services. Second segment is those who can't afford upfront payment, but can pay gradually through loan. The third category is those who can afford to pay upfront. The first one, they really can go for the market-based approach clearly. And the first one, the poorest of the poor, who can't afford both loan and upfront payment, needs subsidy. We can use those three different approaches for consumers really to pay for their services.
Thank you.
That hits the nail on the head of there's no one perfect solution. You have to look at the needs of the community in question, and having the subsidies as an option, having market-based as an option. Very cool. Thank you. Thanks. I will ask one last question to the panelists. What is your number one recommendation for scaling household water treatment to the millions that need it? We've talked about a lot, so you might even pull from previous comments that you've made too, but just as a nice ending note for the questions here. Yeah, Jeremy, start us off.
I'll start out here.
Yeah.
This comes a little bit from my last answer too, but for us at Business Connect, the largest thing is we approach it with our ears open and our mouths shut. Because there's listening in the communities of what that community needs, if that government is engaging or not engaging. That's why we have NGOs, non-governmental organizations that maybe come across it. Maybe there's a market there where there's already things there. And so approaching this with, and we talk about this with the Business Connect, the mom that desires to provide safe water for her husband to be able to go to work every day, for her family, and that goes for every one of us. I want to make sure I have safe water in my home for my children. My wife wants that. So how do we do that? And then how do we meet that? Maybe that's aid, maybe that's government, maybe that's market. How do we pay for that is a big issue, which is why I'm the market-based approach, so we can drive through whatever season goes through. But there's all those solutions, and having our ears open first when we go into a community is the biggest part of posture to solve this. That we don't come in to make a splash. We come in. For Business Connect, we have a bunch of different solutions. We have 400 different solutions. Sorry, manufacturers, if yours doesn't get sold, too bad. Because it is defined by where we go and who has it in their home. So that's, for me, that's the biggest part of this challenge, is making sure we're doing that.
Thank you. Yeah, I love that. Go for it, Hank.
I think the biggest, at least in my view, the biggest challenge is awareness. And awareness on a range of levels. First, awareness of the potential of household treatment. Awareness at national level, at policymakers, that they understand that it is a solution and it is a low cost, relatively low cost, and I think the most cost-effective option to have safe water for everyone. And I challenge everyone to give me a cheaper option. It's the cheapest option and the most sustainable option for safe water for the world. unless others come with other solutions. So awareness on the new technologies. 20 years ago, we didn't have all these nice filters. Now we have filters that can take out PFAS even, and lead, and you know, there's a range of technology that we did not have before. People are not aware of those things. Awareness on, for instance, water by women. $4 per person. Copy paste.
Thank you. To me, the first one is really to understand the context of the area of the country. And the second one is HWTS, household water treatment as safe storage, is not a standalone service or solution. It is part of the bigger package of the solution. When we think of household water treatment and safe storage, again, we need to be careful in a way that we need to connect that solution with other different options. For example, piped water system. In areas where there is a piped water system, there could be reliability issue, or water is intermittent, in which case we need to disinfect, we need to treat. In areas where there is low awareness related to behavior, we need to connect HWTS with behavioral change. In areas which is totally underserved, where there is no protected water, be it well, be it pipe system, we need to keep in mind about raw water, what kinds of water are we going to treat. So HWTS is part of all this solution, and it is not really a standalone solution. So whenever we promote HWTS, we need to understand the context, what government policies and the guidelines is saying, and also the reality of the nature, the type of the services in that area, and we need to connect that with that aspect. We all know the potential of HWTS scaling. Why? Because some are underserved, some have unreliable water services, some are not really trusting the utilities, the service providers. So we need to clearly work with consumers and service providers, including utility, in a way that utility don't assume about like the under quality of their services. They need to consider HWTS as part of their solution toward supplying reliable and clean water to their customer. Thank you.
Thank you. Yeah, one last thought, Hank.
And I have a commercial. There is some information here on the model of water for women and safe water. Thank you.
Thank you. And Lorraine, did you want to add anything? Yes, please.
Yes. You know, I think as is natural and with many great benefits, we come to this project, into this endeavor, all of us, from a Western mindset. And there is much to be said for all of that. What we learn from more, I would say, even an indigenous or native people's kind of mindset, or what we can recognize there, is the capacity of the human spirit, and to not underestimate that. We are hardwired for compassion. We are hardwired for care for one another. That is how the human species managed to grow, is because we were hardwired in that way. Last week, I was talking with a partner of ours who's working with Maasai and talking about the superhero aspect of that, and him just saying very enthusiastically, this is how Maasai have survived through many, many millennia, is by caring about one another and being willing to share. I've had Western missionaries tell me this model would not work in Haiti. And Haitians tell me this is a perfect model because nothing gives us greater joy than to share. And so when we look at the scale of need Again, that's what I heard in your question. When we look at the scale of need, how can we the most quickly scale up? I believe it's by tapping into that human spirit, that human resource for love. Thank you.
Thank you, Lorraine. That was a perfect bow for all the questions. Wasn't even prompted. Thank you all so much. This was such a cool panel for me because I got to hear more from a policy perspective from LaMesa, subsidies and using community networks and marketing and sales we're all having the same goal. We want people to have safe drinking water. So that was the purpose of this session, was to learn more from a bunch of different perspectives. I still have more questions going through my mind, so please don't stop the conversation here. Feel free to ask any of us questions. I don't know how much I can answer, but they can answer. And yeah, we'll be around. We do plan to publish a informal report from this session. So if there's any other thoughts or comments or suggestions from the session you want to add, we can get quotes and voices into that report on the Business Connect website. So yeah, thank you all so much. And thank you to all of our panelists and Hank for helping to organize this, Business Connect for helping with the Zoom and getting Lorraine on here. So thank you all so much.
Thank you.
Thanks for coming.
Thank you so much.
Thank you. Lovely to hear you. Yeah,
Sorry, I didn't accept.
No, that's great. I was like, oh,
Thank you, Lorraine.
I know, I was gonna
Say thank you.
Bye, Lorraine. You're welcome to stay on, but
Okay, I just want, if someone else has questions, I can stay for a little
okay,
bit.
perfect.
Yes, yeah, it's good.
Sounds good.
We are very taken up with our Haiti issues right now.
Yeah, our prayers are with you, Lorraine, for sure.
Thank you. Our team was very hard hit.
Yeah, that's good. I'm sure that it's devastating right now, and sorting out what are the next steps right now. And thank you.
Did you? Okay. It's a little, yeah. So you love Business Connect?
Yeah.
You're there for,
Love having, love the growth and love where getting the body drop.
Yeah.
And so I don't know. But there's room for PhDs though, so no.
Do you want to do that?
How are you?
Yeah. Y'all are 400 pounds. Keeps getting added to the
It is.
Wow.
We need another champion, you know. We have to have more conversations.
Yeah, we can